Hi, I'm Dr. Kivett in Santa Rosa, California. I'm a board-certified plastic surgeon and dermatologist with significant experience in a number of issues, including sun damage and skin cancers. A significant portion of my practice involves dealing with skin cancers, detection of precancerous lesions, and the treatments thereof. I've actually written book chapters and published articles on these issues, and I'd like to focus today on one particular aspect of something that many people are not aware of. When we talk about sun damage prevention, that involves the usual thing you'd expect with talking about sunscreens and brim hats and long sleeves and so forth. That's what I label as prevention of future damage. What is not understood as much is the discussion of reversal of portions of existing damage. And people say, how's that possible? Well, it's possible because over the years, there's been a focus on prevention, which I think is so vastly important to help people come back from a number of situations in which they've had skin cancers over the years. And our goal is to help keep them from having to come in this office or the offices of other people to have surgeries or to have other treatments, painful or not, for lesions that they've developed because of years and years of sun exposure. It's not a complete reversal of sun damage, you understand, but there are things that can be done. In one of my chapters, which was 69 pages actually, that I co-authored with a fellow who helped us obtain 789 references for the chapter, 3 of which were my own publications, we are able to talk about various topical medicines, that is to say, medicines that are placed directly onto the skin that help make a difference. There's also light treatment that helps too. I wanted to focus though on the fact that these medicines are used to stimulate the immune system to come into a given area where the medicine is applied, and in so stimulating the immune system will have a specific effect on killing off cells that are precancers that are sitting there. There's one particular medicine that I deal with a great deal more than the other ones, because not only is it a specific medicine for helping the immune system attack precancerous skin spots, but in fact, instead of attacking the entirety of the skin in the hopes of destroying those skin spots, it actually attacks individual cells that are growing in such a way that they can be destroyed individually as cells. The analogy would be that if you go in your backyard and you have weeds growing in the backyard, you put out the weed killer and the weeds die and the grass stays. That's an ideal situation. You could also have the analogy that you go in the backyard with a flamethrower and you kill off the weeds. But think of all the extra damage to the surrounding tissues, the surrounding grass growing in the yard. So the one medicine that I prescribe the most for patients is called Efudex, which is the brand name, or 5-fluorouracil, which is the generic name for it, and it's also called 5-FU. And it was developed starting in 1959 and put on the market in 1962. And the description of it as a weed killer, I think, is apt, because precancerous cells of the type that come from the center of the skin, the squamous layer, are growing, and there are actual cancer cells there, but not enough to warrant being called skin cancer by the microscope examining physician. So those cells are characterized, and you can feel them in your own skin if you have sun damage. If there's like a little spine that sticks up and it catches your finger on it when you rub it, then that's, in some cases, many cases, the precancerous skin cell. About 5% of them actually become bona fide skin cancers, meaning the number of individual cancer cells grow to such a point that the microscope doctor now says these are actual skin cancers of a squamous cell type rather than precancers. Because these cells are growing faster, they're turning over faster, because our skin, we're turning it over, we're molting like snakes, if you will. So it's absorbing various elements that help grow DNA. And so the DNA is 1 splits to 2 to 4 to 6, or 4 to 8 rather. And so this particular cream that I'm describing has one of the base pairs of DNA called uracil and a fluorine atom, which is highly reactive. They knew this way back then in the late 50s. This is attached, the fluorine atom is attached and is uptaken into the cells. And so as the one cell type becomes two and so forth, that fluorine atom is pulled into that conveyor belt of growth. And that fluorine atom simply brings those cells to a halt. They just come to a halt. They don't die. And so your immune system, if we think about it for a minute, it's part of what's called your biogenome, which is comprised of about 100 trillion cells, many of which are located in the cecum, which is the junction between the large and the small bowel. And so that accounts for a great deal of your immune system strength. And so those cells are always circulating around, looking around for cancers, looking around for splinters in your skin, looking around for strep in your throat, looking around for internal cancers. And in so doing, finds these stopped, frozen cells and very indiscriminately kills them, inflames them. And so what I like about the cream, as you apply it to your skin, is that it affects only the faster growing cells, whether they're the precancerous cells or warts or scars, all of which are growing cells a little faster than your baseline skin. And so if the cells are being inflamed by your immune system, they will in fact be destroyed. And so what you see on the skin is a variety of things. You may see nothing, which means that you don't have any precancer cells. So it teaches you, it reassures you about what you have and what you don't have. Or you may get 20 little tiny spots. Those 20 little tiny spots are precancer cells that are dying off. The rest of the skin is not pink, therefore you only have those 20, they're dying off, and your chances of having a cancer there in the future with some continuing protection from sun are, your chances are much less to have skin cancer. Or you may get a sheet of fine pink with fine scaling, meaning the entirety of that skin has been cooked enough over the years that all of the major cell growth in that area is being attacked and destroyed. So the goal is to have the skin be pink. If you don't remember anything else from this visit today, the pink is what you're looking for. You're not looking for fire engine red. And some people actually get fire engine red, and that's the stuff that when you look this up with Dr. Google online later today after watching this video, then you'll see people who are either bragging or maligning the fact that they have bright red, oozing, weeping, dripping changes on the skin, crusting. And it's not necessary to go to that length. If you have the cream start to cause that, and you're using it twice a day, then the key is to simply back off and use it maybe twice a week, because the goal, the one word to remember today, is pink. This is cancer chemotherapy, but your body does not absorb it. It doesn't get into your skin deeply. It doesn't cause you to lose hair, have your white blood cell count go down. It doesn't affect your immune system in a negative way. And so it is actually used intravenously in people with GI tract cancers and other cancers as an anti-metabolite, it's called, to shut down cell growth. So something to consider. And if you find that you need this kind of thing for helping yourself reverse sun damage so that you don't have more cancers, it's worthwhile to come in and speak with us, and we can help you in that regard. The other immune system stimulants, some of which help you for certain kinds of tumors, have some value too, but I think there's a more specific cell type that's damaged with the squamous cell particularly, and so we could talk about that at more length, and your family doctor can, or whichever doctor of the skin that you see wherever you are will be able to talk to you in a much more cogent way about this whole thing. If this has been helpful, please give us a thumbs up, leave a question or a comment, and always, if you want to see more educational videos like this, be sure to subscribe. Thanks for listening.